So this clip is about the prospects of cure, and we would be requesting guidance and advice from Sir about what he feels are some oncology situations which are more curable, or some are more hopeless, or whichever kind of prognosis. We do very well understand as practicing physicians that it's not possible to narrate the same prognosis for every person because of multiple stakeholders or variable factors, not only the immune status of the person, other comorbidities, not only the gender variations or other factors of nutrition and environment, and of course the very most important, the state of mind and the emotional health. So all these are there definitely as stakeholders, but nevertheless at a simple level of a general understanding, the request of our question is about, sir, what do you feel in your experience that some cancers are more behaving in our favor and some are not much behaving? Because I was in contact, and I'm still in contact with Sir in his different cases and prognosis. So I do remember being conveyed to me sarcomas are really tough. CA breast is comparatively better, and kind of thing. So I think it is best from his own words.
Say in 1850, Sir James Paget, the famous surgeon, said that cancer is not a surgical disease. Now, cancer surgery is so common. There are oncosurgeons dealing with only cancer, but invariably, in 99% of cases, they come with secondaries, especially in breast. You should never touch breast with knife. George Cryle Sr. in 1830, he started surgery on the breast, that is, a removal of the breast for cancer.
Mastectomy, yeah.
Mastectomy. Now, Cryle Jr., his son, says there is absolutely no place for mastectomy in cancer breast. In fact, cancer breast can be 100% cured by one, improving the immunity of the patient, and two, by controlling the tumor with a little bit of chemotherapy. So chemotherapy combined with hormone therapy, combined with Siddha, without any exaggeration or any pride, I say I can cure 99% of cancer breast cases. But there are cases, especially in young women, very active disease, where no force on earth can do any relief to them. They die within months after diagnosis, especially young women, 25, 26, 30. The tumor is so aggressive. Probably there is a fundamental weakness in their immune system that results in, the result of this treatment is failure is because of that. But in all older women, whether the tumor is not aggressive, when the tumor is aggressive, there is no point in surgery also. So if the tumor is controllable with a little bit of chemotherapy, a large dose of hormone therapy, and large doses of Siddha medicines, I can cure any disease, any cancer breast cases, especially in older women with all this, without touching them with knife. Knife is fatal. There is absolutely no doubt. You are introducing, with the knife, you are making the tumor spread so rapidly. They come with massive secondaries after these surgical operations. So best is not to touch. Even biopsy is contraindicated. If you can diagnosed with FNSC. Even I say FNSC also is dangerous. If a tumor is without visible, I mean, you can actually, from the appearance of the tumor, you can conclude it is cancer. You do not go for any open biopsy. It is so dangerous. So I am always very particular that open biopsy is contraindicated. At the most, you can do FNAC to complete your record. That's all. And then start on with hormone, Siddha, and a little bit of chemotherapy. 100% cure I can guarantee in a 90% of patients. That is my experience for the last 40 years. 40 years. When I started using Siddha, because Siddha, it has absolutely no effect on cancer cells, but it has got immense effect on the immune system. So you improve the immune system of the patient, and the immune system looks after the cancer. That is my principle of treatment today.
And I have realized how Sir has been prescribing to almost every oncology patient Ashwagandha, Guluchi, Satta, and those group of which in Ayurveda are Rasayana in nature. Sir, and I think
Yes.
Sir himself is a beneficiary and regular user of...
Yes. I'll say Siddha, I am using this Ashwagandha for the last 40 years. I don't know whether you heard about it. There was the Bhopal gas tragedy after 1984. There was a report in the Hindu paper that those people who took Ashwagandha got cured of the respiratory problems. See, it was a gaseous thing. And from that day onwards, till today morning, I am using Ashwagandha every day. And I don't know, I have in my memory, I don't have any memory where I had even cold, severe cold. Never. I never had a severe cold in my recent memory of 5 or 10 years.
Yeah. After starting
After
Ashwagandha.
starting this Ashwagandha. It's beautiful. And there is Harinath, that gentleman from New Zealand,
Yes.
Calicut, Harinath.
Yeah.
He was almost on the deathbed after treatment for years for Hodgkin's disease. And he was almost dying when he resigned his job in New Zealand and came back to Calicut. And he went to Ayurveda hospital and they gave him Ashwagandha, and he is now back in job in excellent health. Harinath from Calicut. I think he has got a
it has
website.
come in the internet, and we have seen that narration very clearly how much impact Ashwagandha had. And I am quite optimistic in today's corona situation. Ashwagandha has a big role.
Excellent role.
Yeah.
There is absolutely no
We'll
fear.
be making a different clip for Ashwagandha and certain other herbs on a
Such
different
a
time.
cheap thing.
Yeah.
It's very simple.
Yeah. On a different day, but this was just to bring to the point of the misuse or of surgery, if we call it. I have seen, being in the OPD of Sir, I have seen in these many days in his clinic dealing with the patients, how he would really literally lament and feel so upset that many of the CA breast patients are going under the knife. And if that was totally curing, it was fantastic, but that is not the reality. Many times it is recurrence, and that is a tragedy. Of course, that could have been avoided. So now we stop this clip for the next one, which is about surgery.